I'm Dr. Michael DeTola.
And I'm Megan Strong.
We've got a story that gives new meaning to the term eye tooth. A child wakes up with an unwanted grill.
And the conclusion of our exclusive 3-part interview with Dr. Gordon Christensen. All that and more on today's Chairside Live.
Welcome to episode 35 of Chairside Live. Megan, are you feeling strong?
No, actually I'm a little under the weather. So
are you
you're
really?
Gonna have to forgive the froggy voice, and I'm just trying to get better.
I appreciate you playing injured. We're honored to have you here, and don't breathe or cough near me. We got an interesting case of the week for you. You can probably guess what it is. It's part 3 of our exclusive interview with Dr. Gordon Christensen. And if there's anybody in dentistry, you don't keep waiting. It's Dr. Gordon Christensen, so let's go to that right now. I get a lot of questions about EMAX specifically, about whether I cement it or bond it into place. And I've cemented probably 85% of our EMAX when the prep is, 3 to 4 millimeters tall and we've got 8 to 10 degrees.
That's about what I say.
And I bond it otherwise, so you feel kind of that same way?
I had quite a discussion with Ivoclar over that. We went about a week back and forth, back and forth, back and forth with their leadership, because they were highly promoting bonding.
They were and are.
And we did a study on that where you made the crowns, Widewell made the crowns in vitro, and we cut them off. And what we found was very, very interesting. It took, to take an EMAX crown off, or a Bruxer. Bruxer was actually easier to get off, but to take an EMAX crown took 4 diamonds, and we eliminated the carbide steel burrs because they did not do as well as the cheapo diamonds. A $1.50 diamond cut better. So it took 4 diamonds per crown, it took 4 slots per crown, and it took 4 minutes per crown. It's easy to remember, 4, 4, 4, and that's a lot of time, and it's a lot of money to hack the thing off, but that's not the important thing. The cement, let's say I'm using their cement, multi-link auto mix, and it's going to be semi-tooth colored. You're cutting through the EMAX, cutting, 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 cutting. It's pink, I must be there. You hear what I'm saying? In other words, you couldn't tell the cement from the crown from the tooth. Now you can with the zirconia a little better because there's a slightly different color. But if you go to a resin-modified glass ionomer, now you're seeing a different color. You're cutting, cutting, cutting. Ooh, I just hit a different color. Stop! What we found was we mutilated the teeth when we used the resin cement. When we used a resin-modified glass ionomer cement, you knew it was there, you stopped. But you look at some of those preps where we cut the crowns off with resin cement, and they're mutilated preps.
Yeah, I've had a couple where you cut it off and you finally get the crown off and you can see where you went too deep. And I always turn to my assistant and said, I've decided to place an anti-rotational groove here on the facial. She goes like, hell you did, that, and she knows what happened. And that's a good point, because the whole discussion seems to be about what's going to retain the EMAX crown better, but we know these crowns aren't going to last forever, as good as they are, and you don't want to do an inadvertent hemisection of the tooth when you go to take that crown.
What I'm suggesting, Mike, is that if there is 4 millimeters from the gingival line to the occlusal table, and it's reasonably parallel, now the Fantasyland academics will say 5 or 8 degrees. I'm going to say 20 is average, which I think many have shown. Let's say we got a 20-degree divergence. We've got 4 millimeters from gingival line to occlusal table, and there's not any peculiar occlusal habit or anything, just cement it.
Right. Good.
Now, if you've got a shorter one, you've got a lower molar that's only 2 millimeters high sticking out of the gum, or you've got a very thin lateral incisor, something where the color of the opacity of the resin-modified glass ionomer will show through, now you got to bond it, whether you want to or not. So color relates and height of the prep relates. Other than that, cement it.
Wow, I'm glad to hear you say that, and I'm really glad to hear you bring up that other point about cutting it off and the safety of it. I'm going to add that to my lecture notes immediately. And as always happens when I get a chance to spend some time with you, I've learned 3 or 4 things that would have taken me 10 years to learn from practical experience. So.
I often in a course I'll say, like we just were talking about, let's cement it. And a young dentist will say, why are you taking it off? And I'll just say, well, you'll find out.
Right.
It's just a matter of time.
It's just a matter of time, yeah, and nothing lasts forever.
You're going to take it off.
You are going to take it off, and we need to keep that in mind. And there were rumors in the beginning that Bruxer was so tough you wouldn't be able to make an endo access hole through it, and people would say, I heard this lecturer say that you would never be able to do an endo access hole. And I was like, well, Of course you can. I mean, how would you get it off otherwise? But you guys have done, I saw some stuff at CEREC 27.5 where you had done just that, a lot of endo access
That's
openings.
in this month's clinician's report, the making of holes through lithium disilicate and through Bruxer. And again, we found the diamonds were the best, the round-ended diamond, not necessarily round, but round-ended diamond with lots of water and with a not a straight down motion, with a slightly lateral motion, peck, 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 and then finally you get through it. If we look at it under electron microscope, the Bruxer did not, so far, and I'm not done yet, it's not going to be published for a week, but the Bruxer in the endo hole did not have much micro cracking around it, where the Emax did. The Emax had minor cracks that were going out and had little kind of scallops of Emax that looked like, much like a hammer on a windshield of a car. It doesn't fall out, right. It's just cracked. And then under stress, it falls out. So basically what we're learning from that is with Bruxer, there's not a significant problem. With Emax, when the hole is made, you're done with the endo, everything's ready to plug the hole, it's well to take a very fine diamond and smooth out those little scallops so that they will not chip out.
Which is very light pressure and just get rid of them.
You still have micro cracks going out from it.
You feel that both those materials do better with an endo access hole than a PFM would do, for example?
No, depends. As you know, and people watching this know, van der Waals forces are what hold a porcelain fused metal, porcelain to metal.
Right.
And as soon as you penetrate that ceramic, you've broken van der Waals forces. Only women know how two glasses of the same diameter, drinking glasses put together, you can't separate the glasses unless you jiggle them or you break one, now it'll come apart. Same thing with porcelain fused metal. You penetrate that porcelain fused metal, it's just like breaking the glass. And very rapidly, I have one in my own mouth right now, a brand new crown, where the porcelain fused metal crown had been on more than 25 years. I had endo in the tooth. 6 weeks later, I ate the porcelain. In other words, it came off.
Right.
So when you ask the question, is it better or worse, I'd have to say porcelain fused metal will fracture more subsequent to the, I might have said it backwards before, but will fracture more when the endo hole is made than will Bruxer, which is not doing much of anything.
Right.
And Emax we still have to figure out because we've got those little scallops, which you'll see in this month's clinician's report.
That's how I felt. And I think you did say it right the second time. I felt like on the PFMs that the glass seemed to be kind of shattering more and setting up stresses in there that might come apart at some point.
And what's amazing too is, depending on the laboratory, of course, you folks run a very controlled laboratory, but a lot of the mom and pop labs, which were going down, 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 unbelievably. But as we look at those, every day is a little bit different, and every crown's a little bit different. I've had, over the years, I've had PFMs just cleave completely off the metal. You're looking at naked metal where there was no impregnation, there was no even slight chemical interaction, and chemistry is not a big part of the bond, as you know. It's mainly van der Waals forces.
Yeah, and it seems very mysterious to me, and it seems amazing that the PFM was the workhorse that it was for all those decades and did so well, but it's amazing to see how dentists are voting with their wallets and their prescription forms. They're choosing this new generation. So it remains to be seen what the landscape will look like 5 years from now.
You've set the marketplace on fire with Bruxer.
Well, we breathe a sigh of relief every time you and Rella send us some positive information about the wear facets or they're doing an endo access through it. So it's good to see these new materials are performing well, because I think it does really bode well for dentists and patients alike.
I do too. And she is the ultimate nitpicker too, and if there's anything wrong, she'll say it. I think something I saw this morning, and that is the internal staining of a Bruxer crown looks very, very promising, because we do know that with all the acidic foods that all of us eat today, that superficially placed stains on a crown, not at a high temperature, and obviously a typical lab tech would rather do it at a lower temperature. You're controlled here, but most of the labs aren't. They'd rather do it at a lower temperature because if you do it at a higher temperature, you turn it into a marble.
Exactly.
So they would rather do it at a lower temperature. And let's just take some examples. You take any one of the energy drinks. I don't even care. Red Bull. 10 times more dissolution of enamel or ceramic stains than a Coca-Cola, which is always indicted as being terrible and so acidic. I'm just doing a study right now on the acidity of various foods that we eat, and people will say, well, I don't drink Coke, I drink lemonade. 10 times worse than Coke, lemonade. So we're not going to avoid these acidic things. Right. So to have the stains internal will mean the crown will last longer with an aesthetic orientation.
Yeah, and even in the posterior, when the dentist does an occlusal adjustment, you know, you don't want the white of the zirconia showing through the way it used to be stained. With the new one where it's all color and shaded, you don't have to worry about that in the posterior either.
Fantastic. Translucence. How long do you think it's going to be before we have translucence in zirconia crowns?
Well, it depends. How much translucence do you want?
No, not a lot.
Yeah, to me, translucence needs to be significant enough that we can make a single unit anterior restoration, place it next to the natural tooth, and have it blend in reasonably well. By the same token, I want to be able to put, I just did some crowns on a tetracycline patient here at the laboratory. Very deep, dark tetracycline stump shade, and we put Bruxer crowns over those and had no show through at all, even at the gingival margin. So we're looking for a sweet spot between having it resemble a natural tooth but not having show through like Empress might if you tried to use it on those dark shades as well too. The race is not for us to get to see-through, you know, it's to get to this kind of happy medium between the two, and I feel like we're pretty close. We've got some anterior cases that we've done. One in particular where it's a patient who's got 2 PFMs and an all-ceramic crown, a natural tooth, and we did a Bruxer crown next to it. So you can see the Bruxer crown, the all-ceramic crown, and the 2 PFMs, and the natural tooth. God's tooth looks the best, the natural tooth. But the Bruxer actually comes in second place. I mean, it's a 10-year-old PFM and an 8-year-old all-ceramic, but it's getting pretty close, and we have dentists now prescribing Bruxer veneers. And we're, you know, starting to do some internal studies here about how do we bond, you know, a zirconia veneer onto a tooth without any mechanical retention whatsoever? That's a finicky bond. You know, zirconia doesn't like to play with much besides phosphate groups. So,
well, you're doing very, very well with it. A financial note for Glidewell to consider. A typical American family makes $55,000 a year, give or take, and the government gets a sizable chunk of that, 30% maybe. So they don't really have much money to spend. If they've got 2 or 3 kids, 2+ would be average, and they're trying to save for a college education and so forth, they can't, my point is, they can't afford an $1,100 crown.
Right.
And you are helping to make them afford it if we can get the dentists to turn more ethical and reduce their, or at least keep their fee the same and not keep raising it. We can get into a typical family that we're not getting into well in the past.
Well, Jim is passionate about that. In fact, one of the projects we've worked on in the past was pre-making zirconia shell crowns. In fact, Jim believes in this enough that he had me do this in his mouth. He was patient number 1. He was subject A. And we prepped the tooth for a crown, and then we kept taking these pre-made zirconia crowns, Bruxer crowns, until we got that one that was close, where I could adjust the contacts. It dropped in. I adjusted like a stainless steel crown, except it was zirconia. And then we bonded to it with some resin and put it into place and bonded it on the tooth. So Jim's idea is let's give dentists a high-strength, relineable crown they can use in the office, so there's no lab bill, no polyvinyl siloxane impression, no 2-week turnaround, kind of a same-day thing. It's a cumbersome system to work with, as you might imagine, and it's difficult to get really accurate margins, but we continue to try to find ways to make it easier for dentists to do it. We just don't expect dentists to, you know, do $1,000 crowns and now start doing, you know, $800 crowns because they're going to get their lab fee for $20. Thus, we want to give them something they can do in their office where if it's a patient who can't afford a crown, they don't just have to send them away, but they can do this procedure, charge $500, and hopefully make the exact same amount that they would if they did a Bruxer crown through the lab.
That is a void right now, definite void. We're working at this point with a similar thing in pedo. As you know, the stainless steel crown is dominated now for 60, 70 years. And they're ugly, and mothers hate them. The kids kind of like them, but the mothers hate them. And New Smile, a little company that's come out now with zirconia crowns, we just did a study on that. We found that the dentist has to cut more tooth away because there's a certain thickness to the crown where the stainless steel was thinner. But I think that has some potential. How did Jim like it?
We didn't. Jim had it in his mouth. Jim's fine with almost anything. He's almost not picky enough as a patient. He rarely complains about things, and he did well until the tooth fractured. Oh, until the tooth. And then it came off, and he thought he could save the tooth, but he couldn't. He mentioned at dinner last night he's got an implant. That's the tooth that ended up having the implant. So that was probably the wrong tooth to put it on. I felt okay about the margins, not great, but maybe it doesn't have to be perfect for $500. Maybe it just has to be sealed, and I don't know. We continue to play around with this, and maybe that's part of the Volks Crown answer, is an in-office thing where a doctor doesn't have the two appointments and the lab bill and those types of things too. So we continue to play with zirconia, and we're not even sure what the future holds for zirconia, but it does look like it's going to be the big player for us, at least in the next 10 to 20 years of restorative
I have predicted
dentistry,
that. I predict it will wipe PFM off within the next few years. There are a few areas where it won't. Long span bridges, precision attachments, and a few other things, but not very many.
I'm looking forward to hearing about the first. I lecture at Loma Linda School of Dentistry every year, and maybe it'll be there, but I'm looking forward to hearing about the first school that allows their students to do a full contour zirconia crown. But you know how the schools are. It might be, 2050.
It could be a long time.
Right. Well, Gordon, as always, thank you so much for your time. I always learn when I'm with you. It's so great, and I know the viewers really enjoyed it as well, so thank you.
Thank you.
That ends our three-part exclusive interview with Dr. Gordon Christensen, and I would just like to thank Gordon. Gordon, fist bump. Awesome. Thanks so much for doing that. Megan, do we have any news?
Yes. An Arizona mother took her 4-year-old daughter in for some routine dental work, but ended up with way more than she bargained for. The dentist told her that her daughter had 4 cavities, and she consented to have them filled. After the procedure, the mom and daughter went home, and the little girl took a nap. Upon waking, the mother peered into her daughter's mouth and was shocked to find that every single tooth in her mouth had been capped with a silver crown. The mother was outraged. Apparently, the dentist didn't have answers for her when she contacted him. Another dentist saw the story and offered to put white veneers on the little girl's crowns for free.
That's a sad story, and if my experience is any indicator, patients are wrong a solid 75% of the time.
Okay.
They hear something wrong from the dentist,
right,
or remember it incorrectly because it's not words or things that they use all the time. So it's weird to think that he would say 4 fillings and it would turn into 20 stainless steel crowns. That seems like a big gulf between the two. But what I could see happening is he's saying you've got 4 teeth that have cavities on them, and as he goes in and cleans them out, they end up being big enough to require stainless steel crowns. And obviously, the dentist should have said something to mom ahead of time, because that is pretty shocking. In fact, we have a pediatric dentist who orders little pediatric Bruxer crowns from us.
Aww.
And so then they reline them chairside, and so they're tooth colored and they're strong. Sure. They're even stronger than a stainless steel crown. Right. So hopefully we'll see more pediatric dentists starting to use that, because I think no matter what the understanding was, if the daughter would have woken up and the mom looks in there and sees 20 tooth-colored crowns, it's going to be a lot different reaction than if she sees
the villain from a James Bond movie.
Exactly.
You know?
I didn't know if you were too young to remember that or not.
No, my dad's a big James Bond fan.
So you've seen Jaws before with those metal teeth? Yeah, you can imagine your daughter waking up from a nap and you see that and your heart just literally stops.
Right.
I've seen moms not bat an eye when their kids break an arm, but every mom I've seen when the kid, breaks their front teeth, they're inconsolable, they're in tears, and it's really shocking to them. So I feel for the mother, and I hope there's going to be better communication between that dentist and his future patients. And I encourage any pediatric dentist to look at the Tough Kid crowns that are actually made out of zirconia and are nice and white, and no parent will object to that. Anything else?
Yes. A California woman recently complained to her doctor about pain in one of her eyes. Turns out she required surgery to remove the small chunks of bone and teeth growing in her eyelid. The woman had paid $20,000 for some cosmetic work to be done, in which her own stem cells were extracted by liposuction from her abdomen and injected into her face. She was told the new tissue would replace the old tissue and would release chemicals that would reverse the signs of aging. The stem cells used are multipotent, which means they can grow into different types of cells, including fat, cartilage, and bone. To finish the surgery, the doctor smoothed out her wrinkles with the dermal filler calcium hydroxyapatite. However, this naturally occurring mineral can prompt stem cells to turn into bone, which is exactly what happened to this woman. Fortunately, she is fully recovered. Could you imagine?
Oh, I don't know if you saw, but I started to retch a couple times during that story because I'm really freaked out about my eyes.
Sure.
And if I ever had teeth or bone or hair growing around my eyes, I would be really bothered. And I saw that story too. And it said when she closed her eyes, she could hear like a clicking sound from the bone, like little pieces of bone rubbing against each other. So sometimes I think in dentistry we do some treatments that are a little bit out there. Sure. But I'll tell you what we don't do in dentistry. We don't suck cells out of your abdomen, stem cells, shoot them into your face, and then add some hydroxyapatite and into some potent brew and see what happens, and then you start growing bones and teeth in your eyelids. That's unbelievable to me, that whole story, what people will do for a cosmetic change.
Sure.
And it's just super creepy on top of it all. But it makes me feel a lot better about dentistry, and I'm glad to hear that she was actually going to be okay.
Definitely.
Very good. All right, now let's go to a segment we call Viewer Mail.
This week's viewer mail comes to us from Dr. Roxana Mashoon in Poway, California, and she has 2 questions for you, Dr. D, and so we'll do them one at a time. She says, can I use Christensen from 3M to cement a lava crown over an implant after treating the inside of the crown with Monobond Plus?
That's a good question, Roxanne. That's actually one that's come up a lot recently. Which cements will work with a zirconia primer like Monobond Plus? And unfortunately, Christensen is one of the ones that will not, because it's a straight glass ionomer cement. If you look at Monobond Plus, it's got these methacrylates in it. And what we need to bond to that is a resin. So you could use a resin cement. It could be a self-etching resin cement, like Multi-Link Automix from Ivoclar, or it could be a resin cement like Panavia F, or it could be a resin-modified glass ionomer, like Reliax Luting Plus, or like Fujisem. So the key to get the cement to stick to something like the Monobond Plus is to make sure that there's a resin component inside the cement. So when you use Monobond Plus, which is the right thing to do on the inside of a zirconia crown, like a lava crown, you want to make sure you use a cement that's either a resin-modified glass ionomer, a self-etching resin cement, or you could even use a full resin cement with a total etch, a dual cure, or something like that if you wanted to use it. As long as there's some resin inside that cement, you're going to be fine.
All right, Dr. D, and her second question says, also, I cemented a lava crown over an abutment-supported implant, but it continues to come off. Does your recommendation of using Iboclean and Ceramer hold true for cementation over an implant abutment as well, or do I need to follow a different protocol? Thank you for your educational videos on cementation of zirconia crowns.
You're welcome. Well, yeah, once you try that zirconia-based crown into the mouth and it comes in contact with saliva, and I just always assume that it does. I don't need to see pools of saliva. I just assume that it does. I do put the Iboclean in and leave it in for 15 to 20 seconds and rinse it out. And that way I'm now going to have those fresh bonding sites on the inside of the zirconia-based crown. And the Ceramer will, in fact, because of the phosphates in the cement, bond to those available zirconia oxide bonding sites on the inside of the crown. So if it keeps falling off, maybe the issue that we're having is that we're not getting a bond to the metal itself of the abutment. Maybe it's too tapered, or maybe it's too short, and that's part of the reason why it's coming off, because it probably shouldn't be coming off, but it is coming off. So let's use a metal primer on the abutment. So let's take something like Z Prime Plus from Bisco, or you could use Monobond Plus from Ivoclar Vivadent, which we mentioned in the first question, and paint that onto the abutment. Both of those will bond to base metals like the titanium abutment that you're talking about. And then you could put that same one, so if you put Monobond Plus on the abutment, you could put it on the inside of the crown, and then use a resin cement, and the resin would stick to the Monobond on the implant abutment, and the Monobond Plus sticks to the titanium, and it would also stick to the restoration. So we'd have a sandwich. We'd have Monobond Plus on both sides, the inside of the crown and the abutment, a resin cement in between, and I think that'll help keep this crown on for the last time. Thanks so much for your questions. What does she win, Megan, for being this week's Viewer Mail?
an autographed photo
of both of us. And since you're a female dentist, I'm pretty sure you only want the picture of me, but you're going to have to suffer like the male dentists do when they have to look at the picture of me. We're going to drop this in the mail and send it down to you at Poway. Thank you so much for your questions. We really appreciate it. And that about wraps it up for this edition of Chairside Live. On behalf of myself, Megan, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. Turns out, she required surgery to move the small chunks of bone and teeth growing in her eyelid. The woman had paid $20,000 for some cosmetic work to be done, in which her own stem cells were extracted by liposuction from her abdomen, and it stopped doing that. Freaking stop doing that. What? Oh my gosh.
It was such a gross story. I didn't think you could see. I was trying to make James laugh. I was retching like a dog.
Doing it the whole time.
You know how dogs, before they throw up, they do like